welcome to another broadcast of MindYourHealth.com. I hope you've been enjoying the broadcast up to this point, and we'll continue to give you or bring to you more exciting and revealing and sometimes not so happy news about what is going on. I would say, fortunately, the news is good, but occasionally we need to point out some of the problem areas so we can give you the good news about what to do about it. So we're not wanting to leave you on an unhappy note at any time. I hope you are telling other people about our broadcast and encouraging them to go on our site, mindyourhealthcast.com, and sign up so that we can email them a notice of what our broadcasts are going to be about, and also any new things that are happening or any expansion, or at some point we're going to be doing podcasts, so we'll be letting you know. That's going to be certainly big news on our webcast, and I'm still considering doing radio broadcasts on the internet, so we'll be letting you know about that if and when it develops. There's just been a lot of things happening here, learning new things, doing some changes in the way we work, applying some new therapies or new approaches to therapy, so that we can really give you the latest out there. Now, we really scanned the internet and the newest books coming out and talking to researchers and therapists all over to keep up with everything that's happening. I always want to bring you as much as is possible the latest information on whatever subject we're going to be talking about. Now, we have completed a weight loss program that's different than anything that's out there. It's a combination of some things that I've learned over time. I've had pretty good success over the years. There's always those few problem weight issues that some people just don't seem to lose, but more and more we have learned ways to be able to handle those, and the newest program is going to prove to be that I don't think there'll be any casualties from it, unless, and when I say casualties, meaning they don't get the results, that if they keep the program, it's going to work. There's been a tremendous amount of research out there, some good, some bad, and some I would not personally recommend. But at this point, it seems to me that I have a pretty good handle on it after almost 40 years of clinical work, that this is probably the ultimate at the moment. I'm not saying we won't learn more a little later, but we will actually do a broadcast on the program itself, and we're going to be doing a lecture at the office, a live lecture, and we will likely record that and make that the basis of the broadcast, and then we may add some other comments to it. But I'm excited about it, and I believe that it's not outlandishly expensive. That sometimes is a problem with some of the programs. Though that's something we have coming right away, and there's some others that I've almost have ready to go. We mentioned the last broadcast, some of those that would be coming up. So today, of course, you know that our subject is, as was mentioned and has been emailed out to those of you who are on our notification list, that the subject is detox. Now, it's interesting about detox because there are many ideas about detox, and sometimes I believe that people are a bit confused. I've heard people say, well, you know, I did a detox program, I don't need to do a detox. It's as though they somehow think it's separated from the whole program. The program that I do really does all of that, and that people are going to be detoxing, because when you put either the things in the body that it needs, or you remove blocks for the body correcting itself, then you will find that these toxins or poisons that have built up in the body that you've accumulated, that have been serving as an inhibition for your body to correct itself, Once those are removed, the body does, but as a part of that process, it throws all those poisons out. So in any case, we're going to go more into detail about the whole subject of detox, but I just wanted to mention that there's a bit of confusion. It's not like it's two different things. Pretty much, you could do a light detox, I suppose, and then it would just be a detox. But if you really want to clean the body and get it working properly, then the program is going to incorporate throwing things out that shouldn't be there. Hence, it will be detox. So, at any rate, we want to go into some specific details. I want you to understand what the process is, and I think that will clarify a lot of issues or a lot of questions that you might have regarding it. Now, I didn't sit down and make a list of all the questions I've been asked about it, but what I'm presenting is going to be a pretty detailed coverage of the subject. And when it's all done, you may say, well, gee, that was too much, or some of that went over my head. But remember, there's always the possibility buying the DVD of our broadcast to go in more detail if you don't understand. Now, my feeling and my experience has been over the years that sometimes I encounter a subject that it just doesn't quite gel with me, or maybe some areas were kind of unclear. And in so doing, I've had to, and like in the case of a video or a DVD, I've had to watch it maybe 2, 3, 4 times. The same thing with recordings. I've sets of cassettes, 6, 8, 10, 12 cassettes in a set that was covering a major subject. And there are times when I've gone through them at least 2 or 3 times, and then maybe 2, 3, 4, 5 years later, I might go back and listen to them again just to make sure that something I heard and knew at the time kind of slipped off to the side, and that I can reinforce what I know, or sometimes it can be a very key piece of information that I missed that I've allowed to slip off into the background. So with all these broadcasts, I'm giving you a tremendous amount of information. You realize that some of these are the results of years of not only clinical experience, but also of research and study on the side. If someone comes in and I start to work with them, and they have some extremely difficult problem or a very unusual problem, many times I do hours of on-the-side study and research and internet probing and looking at them, looking at what's happened to them, maybe asking them more questions about their history that's kind of ambiguous to them at this point, or that they've totally forgotten, and or something they may not think is important and therefore never mention. And all of that takes place to get someone well. So the time I spend with somebody, which is probably more than most people spend, is not always just in the therapy, and even the conversations I have with people, a lot of that is aimed at getting more information and jogging their memory. And I don't know how many times after we've talked for a little while, they think, oh yeah, that was a major issue and it kind of slipped my mind. Didn't put it on their health history form and forgot to tell me when I said what things are really bothering you. I just had that happen in the last couple of days. So I know it does happen, and sometimes it's hard, no matter how things have been bothering you, when you start sitting down and to enumerate them. Once in a while, maybe a key factor will slip away. So it's not a simple matter to get someone well with a very, very, very difficult problem, and of course, mostly that's what we do get. And the other thing I need to tell you at the beginning is that, as relating to detox, many times when I have somebody, or if somebody doesn't go to me, they go somewhere else, wherever they go, if they even go to the health food store and get a group of nutrients that were recommended by the health food store, and they start taking those, all of a sudden they feel really bad. Now, the very first thing that causes them to think, oh, I must be having a bad reaction, and so they quit taking them. And I know sometimes doctors who get into the field of natural medicine after they've been a regular MD for years and years and prescribed lots of drugs, have decided, well, gee, they're not getting well, I need to look into alternative health. And in so doing, they start learning a little bit about vitamins and minerals and sometimes some herbs. And so they have somebody comes in and they put them on this program, and in about 2 days the person calls in and says, oh, I'm feeling terrible. I've developed a sore throat. I am getting a headache. My neck is stiff. I'm aching all over. I think I'm having a bad reaction. And I've known of cases where the doctor, not understanding all of that, would say, oh, well, then you must be having a bad reaction to those things. Don't take them anymore. And that's not really the case. You realize that in our world today, that the diet that the average person eats over the years, which is the SAD diet, the standard American diet, that has all the garbage in it and all of the processed foods and all the lack of nutrients and all the preservatives and pesticides and various types of chemical coloring agents and so forth, that their body is really a mess and they're deficient. They've eaten poor food that's missing all those things that ought to be there, or at least a lot of them, and continually poisoned their body. They drank a lot of tap water that's loaded with chlorine and fluorine and residues of prescription medications and residues of all other kinds of chemicals. That person is really toxic. Their body is kind of shut down. And when they start putting in the right food and some of the right nutrients, the body will say, wow, now I've got the energy to get rid of this stuff. And their body will go into a detox. And the symptoms of detox are what? Now, I've told a lot of people, we give out papers that talk about what you might expect, how you might feel, but they feel like you're coming down with a terrible flu. Could be sore throat, could be a little fever, could be stiff neck, could be a headache either in the back of the head, the front of the head. Their eyes get watery, their nose run, burny eyes. They could have cough up mucus and so forth. They could have aching in their muscles, their joints, or all over their body. Extremely tired, like they can hardly move. Now, those are the symptoms of detox. Those are the symptoms of your body getting rid of a flu virus after you've had a flu virus. And sometimes, I've emphasized this before, but I need to keep doing it because sometimes it takes a while before one day you go, oh, yeah, now I understand. It just doesn't click yet. And so that's why we repeat a lot of things. My own experience is that I've heard things in going to programs, workshops, seminars, and you name it, and in studying and reading, I've kind of glossed over certain things and not really made it click with me. And then one day, all of a sudden, it clicks. And when it clicks, that's when you really understand it and you have it. And so we've talked before when we studied homotoxicology, which is how the body gets sick from poisons from within, whether you put them in or whether they're produced in your body from everyday living. And so those symptoms are the immune system starting to do something, which is to clean up the body and start to restore functions. When you restore functions, you build energy. When you build energy, the body will decide, wow, now I can clean out. And so it produces a set of symptoms. I don't know how many times people over the years have gotten scared, ran to the emergency room, called their doctor, and what's he going to do? He's going to give you antibiotics, he's going to give you a painkiller, he's going to give you an antihistamine, all of these chemicals that help to get you there in the first place. And people still are missing the idea that symptoms are not the disease. The symptoms are the body trying to get rid of something that doesn't belong there. And so whether you trigger those by, quote, detox, or whether they're triggered by your body picking up a virus, and then as it gets rid of that virus, that's where those symptoms come in. Now, I have to reiterate again and again and again until one day you go, oh, maybe blow the horn. Now I understand. Those symptoms are your body getting rid of the problem. and it's not the disease. I keep repeating it over and over. And those of you who may have gotten the DVDs of the homotoxicology after we did that in the early broadcasts, it explains it all. Your body symptoms are not an illness. The body symptoms is your body attempting to get better. And when you pick up a virus, and I've said it before, and I will say it again, and probably again, when you pick up a virus, about the first 3 days, whether it's a flu virus or whatever it is, in most cases, the first 3 days that you have picked this virus up, and if there was a significant amount of it, that it's now disturbed your body in the sense that it entered cells, it's being replicated, it's producing copies of itself, and you're breathing those out to those people around you and passing it on, those first 3 days you don't know it's there. So the virus doesn't attack you, it's just if it gets picked up, taken in the cells, and the cells end up taking the code from the virus and replicating raw material which synthesizes new viral particles, which then come back out and you're blowing it out in your breath, in your saliva, to other people. You're passing it on during that first 3 days and you don't know it. It's basically about the 4th day that now that's all happened. The immune system has kicked in, it's producing antibodies, and it's killing off the viral particles, and it's sloughing off the cells in the respiratory tract, in the mucous membrane and linings that were damaged in the process. Then the immune system starts also, your body throwing the stuff out. It's getting rid of those antibodies that attach to viral particles and then activated them. Then the phagocytes come along and start to digest those. That is when all the symptoms really start. So the goblet cells that line the respiratory tract and the gut tract and the sinuses and so forth, throat, all of these mucous membrane tissues will start producing a lot of mucus. What does the mucus do when it's in heavy production like that? It's to flush the debris out through one of the detox routes, which you're going to be talking about, which is the mucous membrane. And so the heavy mucus that you're blowing out of your nose or you're coughing out of your lungs, and the fever you may develop in that process, because fever is a part of the immune response. The sore throat, which is the lymphatic system, the lymph nodes are the tonsils. That's part of the lymph nodes, not all of them, but the tonsils are lymph nodes. Headache, frontal headache, back headache, stiff neck, achiness all over. That's not you being attacked by the flu, and that's not when it starts. And the coughing that accompanies that, if it's down into the throat bronchial area, those are all ways that your body is eliminating the debris that's left over from having had the virus. Everybody is worried about washing their hands, covering their nose, and doing all of this. And the coughing and sneezing, everybody, including the medical doctors, for some reason it doesn't click with them either. They think that if you do all that, you might not pick up the virus. You've already been exposed to it. You were exposed to it from the time in those first 3 days that you were sitting talking to somebody, or you were drinking after them, or you were shaking their hand, that you didn't realize, nor did they realize, they had a virus going on. But it's only that clean-out process, which is the immune response, to get rid of the debris that are the symptoms. And that's what happens with detox. Those are the symptoms of your body getting rid of something that doesn't belong there. Now, I don't know, eventually that's going to click. If it hasn't yet, it will. One day you're going to say, oh yeah. And so you don't worry, you can't get around somebody because you're going to be coughing and sneezing, so therefore you could spread it. You're not going to spread it now. It's already done. It's already over with. It's now your body's just getting rid of the byproducts of that whole process. So I hope that makes sense. If it didn't, I would go back and I would get the DVDs of homotoxicology and the accompanying material, because there's some printed material that goes along with that. And I would understand that process. Once you understand that inflammation in the body is not an illness, it is a response of the immune system to get rid of something that does not belong in your body. Now, yes, if you take a bunch of antibiotics or steroids or whatever you end up getting, those are going to stop the process. They are immune suppressors. They will make you feel a little better, but have they helped you? They didn't get rid of the virus because, first of all, you can't kill a virus because it doesn't live. The body is the only thing that can get rid of a virus, really. And it does that by immune response, by building antibodies that lock it up so that it cannot attach to anything. And then the phagocytes come along and immerse it in some all of a sudden the word went right out. Hydrogen peroxide, which is an oxidizer, and that destroys or deactivates it, and then the enzymes from the white cells break it down, and that's the end of it. It's gone, but many times, because the white cells have ingested a tremendous amount of this stuff, they die off. And so that's part of the debris that needs to be shut out. In fact, that's what happens when you have a lesion, a boil, or whatever. All that pus is really a combination of materials that have come into that area to break it down and neutralize it and make it into something that can drain out of the body. And you can get rid of it. It's a life-saving maneuver. So, if you take the antibiotics, yes, you may feel better. And if you take an anti-fever product, why do you have a fever? Because heating up your body accelerates metabolism. And also viruses are what are called heat labile, which means if you heat them, they break apart. They are a protein type material and they will disintegrate under heat. That's how you can sterilize, is by using high heat or heat and pressure, as they used to do with an autoclave, and or a very powerful oxidizing substance such as hydrogen peroxide or a chlorine product such as Clorox. Those break it apart. They denature it. And so if you stop the process by taking the antibiotics, then you turn off the fever, you turn off the activity of the immune system, you shut everything down, and because you do that, you do the antihistamines, which turn off the blood flow and the lymph movement into an area where there's a problem. You slow down the process of your body getting rid of it or stop it, and that builds up. That becomes part of your toxic load, and as time goes on, if you get too much there, guess what happens? You start to poison cells. And if you go back to homotoxicology, you will understand what happens. That's called the impregnation phase, where the poisons have built up so much that they start getting into the functional cells. And when they do that, they interfere with the chemistry. The cell doesn't work right, and it becomes sick, and it starts to degenerate. If you keep doing that, eventually those cells become so degenerated that they become a different cell. They de-differentiate. That means a liver cell all of a sudden turns into a non-liver cell. And it disengages from the rest of the cells and the control mechanisms, and now what do you have? You have a neoplastic formation. Neoplastic means a new form. What is a new form? It either is a tumor, malignant or non-malignant, but more often it's going to end up malignant. So what do? The more you suppress the immune system, the more you suppress symptoms over years, you set the stage for a chronic illness, either degenerative or malignant. Now again, if you go back and look at the homotoxicology material, you'll understand the process because we covered it in detail at one time. Maybe you missed it totally. Maybe you didn't tune in at that time. If you did, then I would suggest you actually get the DVDs and that material and you really go through it thoroughly and understand it. Actually, it's a matter of life and death because it's going to shorten your life if you keep suppressing every time your body tries to get rid of something and you don't like it because I don't feel comfortable, I don't like a fever, I don't like the coughing, I don't like the mucus formation, I don't like the congestion, I don't like all this stuff. Well, it's true, it's probably not comfortable, but if you allow it to take place, your body can get rid of things, and down the road is when that's important because no longer are you going to be storing all those poisons up that someday end up putting you into a very serious degenerative problem? Now, of course, this isn't taught in medical school because it's not necessary. The main therapy of medicine today is pharmacology. And what is pharmacology? It's taking a chemical substance that interferes with a process in your body. That means it's either going to shut something down or it's going to overstimulate something, but it's not going to cure anything. It's not intended to cure anything. You understand that down the road, you're better business, because if you suppress enough minor things today, down the road you're going to have a major thing. And then, guess what? Costs much more money, much more expensive drugs, sometimes surgery, and all of these expensive therapies come about. That's one of the reasons we have such a tremendous health/sickness bill in this country, is because pharmacology has suppressed things so much in people that they've become so ill that now they have very serious problems. And you know, sometimes when people are doing natural things, eating a decent diet, keeping their body clean, getting their exercise, getting their thoughts cleaned up, and etc., when they're doing all this, you know, along here's a guy that runs to McDonald's, Pizza Hut, or some of these other companies. I'm not picking on any one of them, and I'm not even picking on them in general. They have a right to exist. It's your choice whether you go and eat or not. You don't have to go. They don't force you to go. They may entice you a little bit, but you don't have to do it. I don't go to McDonald's and eat, not because I don't like the McDonald's people, and they have a right to have that business, and they have a right to put out what they put out. But it's your responsibility to discern, is that what you want to put in your body? That's your choice. If you choose to do it, then I'm not going to tell you don't do it. It's your choice. And, of course, it's your responsibility when something is created down the road out of what you did. And as I say, even going to regular medicine, I'm not going to talk you out of it. It's your choice. And many times people say, well, should I take this drug or should I not? Well, first of all, I think I would go and find out about the drug and what the implications are. And you know that as long as the pharmaceutical and their big ads on TV tell you, either in written form or talk very low, very fast, what all these adverse things could happen, that could happen, all they do is they want to hand you the rose-colored glasses so that you look at it and say, wow, my nose won't drip if I take the drug. Now, of course, you forget to look underneath or listen as they continue. When they drop their voice and go very fast, it could cause a blood clot, it could cause a stroke, it could cause a heart attack, or it could cause death. Are you hearing that? Probably most often not, but they said it or they printed it. What you're hearing is, my nose isn't going to drip. And I'm saying, gee, I think I ought to take off my rose-colored glasses and look at the details, not the hype. And they're not doing anything illegal. They have a right to manufacture the drug, and they have a right for put it on the market, and people have a right to buy it. And it's up to them. But it seems to me it might be to your advantage to become an informed consumer. You might want to know what it is you're putting in your body and what the risk is in doing that. And there has to always be a risk because, why? Because when you put something in your body that shuts it down, what's that going to do? That's going to stop your body from correcting something that it's attempting to correct. Remember, the immune response is corrective in nature. It's to get rid of something that does not belong in your body or that interferes with body function so that you can return to normal health, which is called homeostasis. That means your body can bring itself back into balance. And so the average doctor is not taught a lot of the stuff we're talking about because it's not important. In essence, the physician of today, unless they decide to think on their own, basically are programmed into, okay, if you don't have symptoms, that means you're healthy, which is not true. And therefore, if you take this drug that removes those or blocks those symptoms, then you're better. And of course, the payoff is that, yeah, you probably will feel better right now. If you turn all that off, your fever's going to go down, the sore throat's going to leave, your achiness is going to leave, your headache's going to leave, your stiff neck's going to leave. All of those symptoms that indicate your body is trying to correct something are going to be removed. So I hate to keep pounding on it, but I just know from experience over the years of working with people, for some reason they got this selective hearing problem. They hear the benefit, but they don't hear the disadvantages. And as long as these companies tell you that, they're operating perfectly legal, and I have no qualms. They have a right to do it. And I have no qualms if you want to ignore what they say could happen and go do it, that's all right too. But if you're going to do that, maybe you might want to know what it is you're going to let yourself in for, and then if that risk is acceptable to you, then I say go do it. If you prefer today to have the benefits of the alleviation of your cleansing symptoms, that's fine. I have no argument with you. I said a long time ago, I don't convince or try to sell anybody on natural therapy. If they come to me, I'll tell them what it does and why it works the way it works, the advantages of actually getting your body cleaned up, getting rid of the poisons, and getting rid of all these things that interfere with proper body function and homeostasis. Homeostasis means coming back into balance. If that's what you're interested in, I can do that. If you're interested in speedy relief, then I guess you have to decide and weigh what the consequences can be of that. Now, many times, it doesn't catch up with you immediately. Every time you can have a symptom, you get something that turns off the symptom. You can get away with that a long time, many, many years sometimes. But when it really shows up is in the long run. And see, I've been in the field long enough now. I've seen the two ends of it. I've seen the people who decided they wanted to be healthy and have chosen not to take all the medications and, of course, save a future bill, tremendous bill, or that have decided they did want to take the medications for the speedy relief. And husband and wife, one go one way, one go the other. At the beginning, the husband's laughing at the wife. You're taking that stuff that's making you sick. Well, I mean, look at that. You ache all over, you're tired, you got a sore throat, you got a headache, you're blowing your nose, and look at me. I don't have any of that stuff, and that's fine. But you know what? Down the road, and I've seen it over and over, the one who chose to do all the suppressions is now disabled, in a wheelchair, has advanced cancer, has terrible problems, can't function, hauling his oxygen tank around with him to breathe, and all of that. And then the partner who did not do all that stuff, but instead chose to eat better and to keep their body cleaner, and when something came up, help their body get rid of it as opposed to suppressing it. They've got lots of energy, they're feeling good, they're not disabled. The irony of that is they end up having to take care of the other one who decided to do the other route. So it's something to consider when you're considering, do I want to detox and feel bad like that? I mean, I saw somebody, boy, they looked awful. Their eyes were watering, they were blowing their nose, and they were coughing and snorting, and sometimes it comes out through the skin. Their skin was broken out. I don't want to do that. I want to feel good. And if you do, that's fine with me. That's your choice, as long as you're willing to live with the consequences. Now, sometimes, of course, it doesn't work that way. Somebody else has to live with the consequences because you made a bunch of lousy decisions. But it's your right, and I would defend that right for you to make that choice. However, I'm not so sure I want to help pay the bill because you made the choice, and that's where the rub comes in. Why do you think we have a multi-billion, trillion-dollar so-called health sickness cost right now? Is it because everybody was trying to live healthy and take care of themselves? No. It's because they chose to take things that suppressed all this garbage in their body, and now they're paying the price for it, except they're not paying the whole price. A whole lot of other people are having to pay that price too. And just think what it would be if no one had done anything healthy. We'd have been dead broke a long time ago. The country would have been broke. All the companies, insurance companies would have been broke. And of course, unfortunately, the people who generated the substances that helped create that, they would be in big trouble because everybody couldn't afford it or they'd be dead. So there's a lot of implications if you actually carry it through to its logical conclusion. That's basically what you find out. That's where we are. We're on the verge right now. It's just about ready to collapse. If you look at the cost, and every year more expensive medications. I remember when antibiotics were like 5 cents, 10 cents, 20 cents a piece. Now they're $5, $10, $15, $20 a pill. And why is that? They're making more powerful ones because the body still, in spite of all the suppression, sometimes still tries to fight and save itself. And we have to go to stronger, more expensive chemicals to try to stop those symptoms. Until one day we're on our back and we can't function, and then it's a whole new ball game. And I'm sure many people are saying, gee, how did I get here? How did this happen? Okay, detox or not to detox? That is the question. So now I'm giving you the introduction. Maybe we won't have time for the body of this. Okay, so a lot of times people think of detox, I'll just throw this in terms of alcohol or drugs. They think you hear about a drug detox program, an alcohol detox program. It is true, they got to bleed them off, and they will detox some junk out of their body. And so why do you think that people feel so lousy when they do those programs? It's not only just because of the fact that they're addicted to it, but it's because of the fact of what it's doing to their body when some of this stuff is coming out of there that they've accumulated because of that. Now, interestingly, in recent years, there's a program developed within acupuncture and oriental medicine called acupuncture drug detox, which involves a few body points, usually, and some acupoints in the ears. And what can happen is they can make it a lot simpler because it can restore some of the neurotransmitters that have been shut down because of taking the drugs and or the alcohol, and it can help boost your body some, and if you add some nutrients and so forth, it can be a very good program. But that detox can be nothing like if someone comes in with a very severe degenerative disease, which on the homotoxicology label is like number 2 of the 3 levels of degeneration that can take place in your body. Level 1 is when the chemicals, poisons, whatever it is, first gets into the cells and starts to cause the cells to malfunction, either not make energy very well or just make you feel pretty lousy. Then the next level, however, is when the organ is starting to degenerate. So then you're looking at kidney failure, you're looking at liver failure, you're looking at heart failure. That's when you're in big, big trouble. And the only next step from that is when you get the neoplastic stage, and that's when tumors start to develop, whether malignant or non-malignant. You're in big trouble when it gets to that point. So, detoxing is a way of avoiding to get there. The detoxing is a method of correcting your body and helping your body release and get rid of things that have been stored up, that have been suppressed in. Now, I mentioned it before, antibiotics and steroids are 2 of the most suppressive agents. What they do is they are going to stop the inflammatory process. They're going to stop what would be called the reaction phase in homotoxicology, the inflammations. And remember, that's what an inflammation is. Now, if you just stop the inflammation by taking a suppressive agent, you're going to feel better, but you haven't solved the problem. You've made it worse. You've driven it deeper, and usually you'll come back with something deeper, more serious later, and sometimes pretty fast. I've seen it happen in a day or two because of suppressions. But we don't have time to get into all that, but at least I wanted to give you a little bit of information about that. Now, what we need to talk about is some of the detox routes in the body. And one of the biggies, of course, is the bowel. The bowel tract does a lot of things. The stomach portion of the gastric tract, of course, has the enzymes and the hydrochloric acid to start the breakdown of proteins in the body. And as it goes into the small intestine, the pancreas becomes involved, and the pancreatic enzymes break things down. And then ultimately you have to absorb them through the wall of the small intestine to get into the body, the things you need. And then eventually all the byproducts go into the colon. and some of the minerals and water is absorbed in the colon, and then it's eliminated out of the body. So the bowel tract can become a way that your body can get rid of various toxic materials, and it will cause them to be flushed out if it's working right. Now, that is also can be a detriment because sometimes the bowel doesn't work right and you develop constipation or chronic constipation. That means that now you're not able to eliminate the things that normally might be eliminated through the bowel route. And that can create a major, major problem. And what happens? You poison yourself even more. Why? Because when you disrupt the bowel function, you change the environment of the bowel, and when you change the environment of the bowel, what happens? You disrupt the food sources for good bacteria that live in your bowel, which is sometimes called the normal flora, and you start growing because of the toxins building up, abnormal flora, which then produce more toxins. So that's called auto-intoxication, and the body begins to poison itself because of the accumulated poisons from the bowel tract. I have seen cases I've mentioned before, and maybe jog your memory again, that these poisons, of course, are going to go downward in your body anyhow because of gravity, but I've seen people with the legs from the knee down, the skin turns purple, it all starts actually flaking or peeling off. The legs start oozing with lymphatic fluid, sores develop, abscesses, and your legs are a terrible mess. And I've seen cases like that. If all you did was just clean up the bowel tract, that all disappears because of the fact you were feeding that from the poisons that were being generated in your own body. So it's extremely important, not what your normal practitioner will say, well, whatever's normal for you. If your bowel goes once every 3 days, well, then if that's normal for you, then you're not constipated. Or if it goes once a week, if that's normal for you, don't worry about it. But you know, it seems strange to me if you're putting food in your body 2 to 3 times every day, there's 2 to 3 times every day things that ought to come out the other side or the other end, if you want to think of it that way. And if it's not happening, that stuff is just storing up somewhere. May not be evident to begin with, but down the road you see the people with the big belly and it's not all fat that's puffed out because the bowel is loaded with toxic material. Now, I had a friend who is a physician who did a tremendous amount of post-mortems. And he told me more than once when they would be, and it's the procedure in post-mortem, every organ or part of the body you take out, you put on a scale and weigh it. And so the colon, which normally should maybe be 3, 4, 5 pounds at the most, ends up weighing 50 pounds. Guess what? It's that big around, and there's something in there besides just air. And those are the people who died of some serious illness. The actor John Wayne, you may or may not have heard, they said that his bowel, the colon, weighed about 45 pounds when they put it on the scale. And of course, we know he died of cancer. So it's not a good idea to keep all those things in your body. They need to get out. So the bowel is extremely important. Now, it has, of course, along the way in the small intestine, some lymphatic structures called Peyer's patches. And their job is to create antibodies for things that might get into the bowel tract. Now, if it's working properly and you're not putting so much in and you occasionally pick up something, those are going to help take care of it. And what we need to mention at this point is that, in fact, the immune system is kind of highly involved, and it isn't highly involved with the whole detox process because the immune system denatures or breaks down lots of things that have to be flushed out of the body. And so it's going to be highly involved. So there is a protective system in the small intestine. In fact, there's a second, and that is the production in the mucous membrane of something called secretory immunoglobulin A that's in mucous membranes. And that's the first line of defense. These are antibodies that can attach to and denature or block certain poisons that come in through the mucous membrane. And so that they're all interconnected, so you can't really separate the one from the other. And of course, the symptoms of the detox are immune function of getting rid of these poisons. So as we move along with all these poisons, the next thing that happens is that other parts of the body become involved organ-wise. We know that the kidneys are going to be involved, and that the lungs are going to be involved. In fact, when we talk about the ways that poisons get out of the body, the lungs are the part of the body that puts out the most poisons, because a lot of the stuff is in a volatile state, which means either a liquid or a gas that can be blown out through the lungs, and so the most poison in the body goes out through the lungs. Now, right along behind that is the skin. A tremendous amount of poisons come out through the skin, and either in the form of perspiration, why somebody has such foul-smelling perspiration, is that the body is throwing out a lot of poison through the perspiration. And the other way, of course, the skin throws out things is by boils and by lesions and by breakouts, acne, all that. Those are ways that the body is pushing poisons to the surface that should not be there. Whether it be rancid fats or whether it be other types of poisons, all of those are involved in that process of trying to get it out of the body. That's why you have a breakout. Psoriasis is one of the most difficult things to deal with, and that's a case where the body is so poisoned that the body has developed a compensation or a compensatory symptom to try to keep you from being poisoned to death internally by moving the poisons out to the surface. Those poisons are so toxic, they first poison the dermis, which is the true skin underneath, but you don't see that. But when they come out into the epidermis, they can be so toxic that they actually, those cells look awful. They turn reddish, purplish, and all the skin, as it either gets dry, flaky, and flakes off or peels off, those are signs that your body is detoxing a tremendous amount of poison. Now, your body has chosen that method as a way of saving your life. And in homotoxicology, we talk about that as being a compensatory system. The body's compensating. A boil can be a compensation, or just a fistula, like a hole opens in your skin somewhere in the deeper tissue and keeps draining. I've seen that happen. I had one lady right in the center of her stomach. There was a hole about an inch in diameter that constantly drained fluid out. And it frustrated the doctors because they couldn't find any bacteria. In fact, they wouldn't, because she had had suppressive therapies of steroids and antibiotics for years. And they found no inflammatory reaction. They just found a hole and all this stuff draining out of her body. And everything they tried would not stop it. They gave her antibiotics. They gave her more steroids, which really, in my mind, caused it to begin with. And it wouldn't stop. And so she had a terrible problem. When we put her on a detox program, I wish I had the photos and the permission to show them, but she sent me photos, and it looked like her skin was all coming up. It looked like she had been severely burned in her head, face, and all that, places where she had had surgery, cosmetic surgeries. She had breast reductions, she had facelifts, she had, you name it, tummy tuck, all this stuff she had done to her. And in the process, she became more and more poisoned until finally one day the body said, I'm either going to die or I'm going to drain this stuff out. And so it opened a large hole and started draining. And it would not close until her body really got rid of all the garbage before it would ever close up. So once the body starts it, it's not going to give up until the process is corrected. Meaning it's already found a way to keep you from dying, and it's going to keep using that until it doesn't need it anymore. So that's why psoriasis is so difficult, and it sticks for so long and very hard to manage. But if medicine gives you a steroid to put on your skin, or doses of it internally to stop that, guess what happens? It's not gone. It's just pushed back inside, and the body was trying to get rid of it in the first place by pushing it out. So the drugs win, the body loses, the person gets sicker, so then their liver goes, the kidneys go, something goes internally in the process, or they come down with cancer. So it's your choice, and you need to think about it. Next area we want to talk a little bit about, we mentioned the mucous membranes and why those are important. And you know, women with all the vaginal discharges, you think that that's just something local has happened. No. The body, when it's using mucous membrane as a way to get rid of poisons, that's one of the routes it uses. And so this reoccurring yeast infection is a joke because, and not that it's not miserable, but it's a joke because the body has a lot of poisons in the pelvis and has chosen that route to get rid of them. So what do? You take topical creams that are going to suppress it. You take internal chemicals of various sorts, whether antibiotics or antifungal, which is a type of antibiotic for funguses, in a sense. It's a chemotherapeutic agent is what it really gets down to. And so they give you all this to stop it, but it keeps coming back. Why does it keep coming back? Because your body is using that to protect itself to keep from being even sicker. So you need to understand what's going on. And of course the lymph system is highly involved. The lymph takes care of all these things. And you've got a big problem when the lymphatic system can't handle all the garbage. And we're going to talk about that just a little bit more because the lymph, I guess, is one of those areas in my mind that is not taken care of. Medicine doesn't bother addressing it. Now, sometimes they'll cut the lymph nodes out for you if they're swollen, like the tonsils. And you know, tonsils are lymph nodes. And why do they keep inflaming again and again? Because they're trying to get rid of something. Remember, the body inflames to get rid of something that shouldn't belong there. There's lymphatic systems in the body that the lymph comes from lower body upward and ultimately connect to the circulatory system under the collarbone, into a vein, a major vein called the subclavian vein. So you have the thoracic lymphatic duct that comes up the left side, and down in the center of the body there's a catch basin for all kind of toxins from the bowel, from the bladder, from the appendix, from whatever else is going on inside the body. Empties all those poisons into this catch basin called the cisterna chyli. And there's also a connection to that from the spleen, because the spleen, white pulp of the spleen, is involved in either activating or producing white cells that are part of the immune process to help break down the poisons. Now, we need to talk a little bit more about the lymph, and that is that the lymph system is where poisons go when they're too toxic to get back into the blood. Now, you know that the blood, whenever it brings nutrients to the tissue of the body and the cells of the organs and so forth, the blood doesn't drip out into the matrix, which is the surrounding tissue that the vessels are running through it. It doesn't do that. The nutrients go through the walls of the blood vessel, go through this matrix, which we've talked about before, but before we're done with this subject, which looks to me like it's probably going to be a 2-session subject, it has to go through this matrix, and it has to go through a membrane called basement membrane. It has to go through the cell wall. It has to get into the cell to get the nutrients in there. The byproducts come back out of the cells, go back through the cell wall, go back through the basement membrane, go back into this matrix. And if they're not too toxic, they end up going back into the blood. Now, the toxins that are more poisonous, the body will not allow into the blood. Now, the poisonousness, as a rule, has to do with the size of the molecules. The more toxic it is, usually it's larger molecules. So the body is not going to let those larger, more toxic molecules back into the blood because of why? Because of blood sepsis. If it's too poisoned, the body will mount a tremendous immune response inside the blood, which can bring on a lot of fever and a lot of, because now you're talking something life-threatening. Because if the blood is so poisoned, it has to carry oxygen, it has to do a lot of things. If it gets too poisoned and it's too much going on, it can be fatal. Okay, so the body's not going to let that happen if it can avoid it. So it only lets the minor poisons in the blood. The more toxic things end up going into the lymph, because the lymph vessels, the walls are larger, the openings are, and so larger molecules can go into the lymphatic system. Now what happens when they get into the lymphatic system is kind of a yellowish, clear looking liquid with a lot of white cells in it and a lot of nodes ever so often. In other words, they're like hollow tubes, just like blood vessels, except they don't have blood, they have lymph fluid, which is a protein-like material, and as I say, has lots of white cells. So once it gets in the lymph, it can't stay there forever, because then you could poison the lymph and have a lymphoma. So you don't want to do that, or Hodgkin's. You don't want to have that. So the white cells attempt to neutralize these poisons. However, the body, it's so critical that those poisons be neutralized before they can get back into the blood to ultimately get to the liver. So once they get back into the lymph, and the lymph attempts to neutralize them, if by the time they've gotten to a lymph node and they still are too toxic, guess what happens? The lymph node is like a gate, a gatekeeper. So when the toxins get in there, if the sensors sense that it's still way too toxic to get back to the blood, they close the gate. Now when they close the gate, they start pumping out more white cells and phagocytes, which are a type of white cell that digest things. And there's a secondary then attempt there, but more rigorous, to get rid of the toxic nature of those big toxic molecules. So if it's very toxic, guess what happens? The lymph nodes swell up because they won't let anything through. They swell up, and the body brings more white cells in, as well as those that can be manufactured in the lymph nodes. And guess what? They get hot. They swell, they get hot, and they turn red. Now, if you remember homotoxicology, or if you don't and haven't gotten the DVD, again, I emphasize it would be to your advantage. If you really want to understand how to be healthy, that's probably the keystone piece of information you need, and then everything starts to make sense. So, if it can't get it out of there, you get an inflammation. The inflammation is that the body brings in more blood vessels, because the lymph nodes also need nutrients because they're cells, active cells, and so they bring in more blood, and it swells up. So you get the 4 signs of inflammation: redness, heat, swelling, and pain. Now, if it's really bad, it triggers the fever response. But now, that's uncomfortable. So you go to your doctor, or you take some Tylenol or some Motrin or some aspirin, because that fever's not really very comfortable. But guess what? It's very necessary. And if you turn that off, you impair the ability to break that down. Now, what happens over time, if you backed up a lot of lymph up into the left upper body, coming from down at a toxic bowel in the pelvic area, come up through the left lymphatic duct, curves over into this whole lymphatic area, and the throat, and the women especially, but men too, the breast area, and so forth. Now this lymph gradually is getting poisoned, but it's not going to let these poisons out there till they're neutralized. And if it can't neutralize, either because there's too many poison, or because you take some things that are going to shut it down, because now you make an appointment with your doctor real fast, or you go to the emergency room and say, wow, feels like these nodes are swollen up into my throat. And he said, no problem, we'll give you an antibiotic, and that'll take care of that. So guess what? It turns off all those processes. So now you have a lymph node full of poisons. You shut down the process. Guess what? Down the road, you could have Hodgkin's lymphoma, because you've let all that poison sit there and refused to allow the body to take care of it. If it happens to come up the right lymphatic duct, a lot of poisons from the liver and the tissue on the right side, the appendix and all that, come up to the right side, you get usually, right side's going to be a non-Hodgkin's lymphoma, if you do the same thing to it. Now, if you don't do that, and if you give the body something that actually helps it to take care of these poisons, guess what happens? It then, at a certain point, will open the gate and let those poisons on through, they go up and connect with the subclavian veins under the collarbone, the clavicle, and once then they can go to the blood because now they're not as poisonous anymore as they were. And in the blood, where do they end up? They end up in the liver, and what does the liver do? The liver finally breaks them down and removes the toxic ability more. And then, once that happens, they either are mixed with the bile, go down through the gastric tract and out with the bowel, or they go back into the blood, they go to the kidneys, and the kidneys pull them out and dump them out in the urine, and then it's over with. Now that's, two of the basic ones is the urine and the bowel, that the problems come out if everything is working right. But now if you stop this process, it never could get back into the blood, then all those poisons over time keep building up and building up until one day your neck swells out like this with a Hodgkin's lymphoma. Then you're in big trouble. With no problem, we'll just give you some chemotherapy, and it's going to poison everything in there. But a big thing it's going to do is turn off the immune system. So you're not going to have any more swelling, you're not going to have any more redness, and you're not going to have any more pain and all of this stuff and heat, because we'll just turn it off with chemotherapy. And wow, magically you feel better. But guess where down the road? It's not the end of it. Never is the end of it. When you suppress something in the body that shouldn't be there and you allow it to get out, you're in big, big trouble. Okay? Just keep that in mind. You're in big, big trouble. Well, I guess we're about as far as we can go today. We've already run over a little bit. Maybe I just talked too much. I don't know. I really want to make it as clear as possible because I want it to grab you. I want you to understand it. Now, most cases, the doctors of regular medicine, the RDs, real doctors, they aren't trained in that because it's not important for them to know that. Because they're not going to do a thing about it anyhow, except if you've got a set of symptoms that they have been issued a drug for, they can prescribe you that drug and it will stop those symptoms. And that's all they really need to know. They don't need to know why. It's not important. So you don't need to study physiology to the same depth you did at one time. You don't need to study pathology to the depth you did at one time. You don't need to study biochemistry to the depth you did at one time. You don't really need to know any of that stuff. All you need to know is what symptoms can you prescribe to. And so basically, unfortunately, modern medicine has gotten to the point that they prescribe to numbers and to pictures. You take an X-ray, a CT scan, an MRI, an ultrasound scan, or you run a blood test and you look at some numbers on there, and so you're either prescribing to numbers or pictures, not to making people healthy. But you could make them feel better for a while. I agree that does happen. So sometimes when you do natural medicine, you're going to feel pretty lousy for a while, even maybe worse than when you came in, for a little while for your body to get that stuff out. But you know what? The more profound the response you get, the faster your body's going to really get cleaned up. And then it's going to be over, meaning you're going to be healthier. And if you want then to start a better lifestyle, you can maintain that. We don't want you to be patients forever, and we aren't talking about practice building by keeping people coming back, because what we're doing is creating more problems down the road that are more serious, that are going to come back for more expensive therapies. I mean, it's good business, I understand that, but it is not making people healthy, and I don't have to argue that. Look at the National Health Bill, health/sickness bill. Are people healthier now? Is there less cancer now than there was before? I don't have to tell you that. It ought to be obvious. If I didn't know what I knew, I still would be saying, what's going on? We're supposed to be highly educated. We're supposed to be scientifically advanced. We're supposed to have one of the best healthcare systems in the world. Why are people sicker? Why are there more chronic illnesses than ever? Why is there more cancer than ever? Something isn't right. I'm only telling you this to maybe jar your thinking a little bit, and maybe you might want to raise some questions. And if you're not getting answers from the doctors you're going to, you might want to look for other alternatives. Now, I'm not condemning medicine. They have a right to do what they do. And if people are willing to come and take it, then that's fine. I would not argue against it. This is the land of the free, and we have a right to do whatever we want to our bodies. The court ruled that in Texas many years ago when They tried to get acupuncture in Texas. The medical people didn't want to do it, but they didn't want a license for acupuncture for people who did want to do it, for the people who wanted to have access to it. So it went to federal court, and guess what the federal judge said? You know, people have a right to make their own decisions regarding their own body, and you know, they even have a right to make the wrong decision. And I believe that. You have a right to make the wrong decision. I'm not talking you out of it. If you're perfectly satisfied and comfortable with buying comfort at the expense of your health, that is your choice, and I wouldn't talk you out of it. As I said, I never try to sell or talk anybody into doing what I do. I do it because I know it works. After 40 years and thousands of people that got well, that was said they were either couldn't get well or that was incurable or for whatever reason, and they did, I know that what I do works. I know doctors who were trained in the other systems and at some point became aware of people weren't getting well and they weren't getting better, and they started looking for other alternatives. So I'm not condemning anything. I'm just saying this is the reality of where we are. You tell me, when you look at the national costs and you look at the state of the health of this country, you tell me if the major system that's been around for years and had the dominance and control, if it's working, fine. Then that's where you should be going. But if it's not producing the results that it should be producing, then I say probably time to look for some other alternative. Anyhow, we used up all our time, and we'll have to finish this, I guess, the next time. My producer always gets happy when I say that. Actually, she doesn't. She thinks, what, you talk so much? No, she doesn't do that either. She leaves it up to me. I'm not censored. I can say whatever I choose to say. I'm never told, no, you shouldn't really say that. And that's good, because I want to give you facts, and don't take my word for it. You know, we keep telling you sources, and if you were to get the DVD on homotoxicology, we tell you sources to go to. It's not my saying, it's just I'm saying it because it's worked. I have experience with it, and I've seen the people get well. I've had people come from Mayo Clinic, been there for 2 and 3 weeks, couldn't find anything, and they got well. Why? Because they were looking for something on the paper, the numbers, or they were looking for something on the pictures. And as I say, it appears that modern medicine basic is treating pictures and numbers and not people. Therefore, look at what we have. Okay, be sure and get other people to come and see our broadcast, and hopefully we can awaken some other people. That basically is one of my big purposes of the two. One is to inform and educate. The second is to awaken you up and make you aware. And if we can accomplish that, I feel that I've done something worthwhile. And I want you to go to the website, mindyourhealthcast.com, look at the pages, look at the things that we talk about. There's book sources there of the books we mentioned to look into. There's other products that can enhance your health. It's up to you. We don't charge for the broadcast, and we make a few pennies on some of the stuff, and I'm laughing because some of it is a few pennies. But anyhow, we make stuff because I have to do a lot of research, and I buy the books that are out there that I keep up with everything that's going on, so there are costs involved. And we want to make and keep the broadcast free, and in order to do that, we make things that I can recommend that I feel that can be beneficial. We make them available through our site as affiliates with other companies, and they pay us a small commission for doing that. And I can assure you I'm not getting rich from it. Anyhow, it was nice to be with you again, and I'll be looking forward to the next time. And we want to help you have rose-colored glasses maybe in your outlook as to having a healthier life. But we want to take them off when it comes to selling you something without you really realizing what it is you're buying, and get your clear glasses on so you can see exactly and you can zero in on it. And we don't want to toot our own horn, but we do in this case, meaning we want to wake you up and get you back and watch another broadcast. So until the next time, be healthier and detox and have fun.